Love spicy foods? Caffeine? Mint? Well, no wonder we all have acid reflux and heartburn, because many of the foods that we eat can wreak havoc on our bodies. Today, I'll review these food culprits and 6 tips to help you get rid of your stomach acid issues. What's up, healthy people? I'm Dr. Majd, host of the Majd MD channel, here to help save you an unnecessary visit to the doctor. Up to a fourth of Americans report having acid reflux or heartburn at least once a week. Not only is it an uncomfortable and potentially painful situation, but it can lead to ulcers that can bleed or perforate, and it can even lead to cancer if left untreated. That's why it's vital to nip it in the bud quickly, and here's exactly how. First of all, avoid all those foods that irritate the stomach lining and that loosen the lower esophageal sphincter, which is that doorway between where the stomach and the esophagus sit, and it makes it easier for the food to regurgitate upward. Here are the main culprits: spicy food, citrus, blueberries, tomato and tomato sauce, mint, greasy, fatty, heavy foods, sodas, alcohol, and caffeine. And this includes chocolate, teas, and even some green teas, would you believe it? And coffee. Now, how many of you are guilty of indulging in these foods? If so, write the word guilty in the comment section below. I can tell you that I'm definitely one of them. Number 2, avoid anti-inflammatories like ibuprofen and Aleve because they tend to irritate the stomach lining, especially if taken on an empty stomach. Now, Tylenol is not an anti-inflammatory and it can be taken for pain and fever instead. Number 3, quit smoking because smoking loosens that lower esophageal sphincter too. Number 4, raise the head of the bed at night because gravity will make it harder for the stomach contents to regurgitate upward. Number 5, eat 5 smaller meals a day instead of 3 big heavy ones because if you overfill the stomach, it will regurgitate more easily. And lastly, lose weight if you're overweight. It will help decrease the pressure placed on the abdomen that can push the stomach contents upward. Now, when experienced more than 2 times a week, doctors recommend a short-term treatment, usually no longer than 1 or 2 months, using acid reducers. And they're now all available over the counter without the need for a prescription. First of all, there are H2 blockers. These are the weaker acid reducers, such as famotidine, which is Pepcid, or ranitidine, which is Zantac, and you can take them twice a day. Best if symptoms are mild or infrequent. And then there are proton pump inhibitors. These are a step up from the H2 blockers and are usually first line for those who experience symptoms more than twice a week. Examples are omeprazole and pantoprazole. Now, if you found this information here useful, please let me know by giving it a thumbs up and share it with someone else who may also find it useful. And don't forget to hit that subscribe button down there because you're not going to want to miss any future episodes now, would you? Check out my Facebook page for up-to-date medical, health, and news tips. Now, all content presented is for informational purposes only, and it's not specific medical advice for any individual. It doesn't replace your own doctor in any way. You should always seek a licensed physician in your area regarding all health-related questions and issues. Well, thanks again for tuning in. Keep that throat and tummy healthy, and I'll catch you next time.